Health officials are urging older U.S. adults to get another COVID-19 shot even before they get a booster in the fall. According to the CDC, Americans 65 and older should get another dose of the updated vaccine. It became available in September if at least 4 months has passed since you got your last shot. Joining us to talk about this and our other health headlines today, it is Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you. Kind of big news from the CDC here. What's the new recommendation?
Right, so the group of advisors that advises the CDC on these recommendations voted 11 to 0, 11 yes to 0 no, to approve an additional booster this year for people 65 and older. There's not a lot of evidence at this point saying that there's waning immunity, but we do know that with these vaccines, the immunity does wane over time, and it wanes faster in older people. And what we've continued to see as kind of the pandemic is sort of wound down, but we still see a significant number of hospitalizations due to COVID-19, and 2/3 of these hospitalizations are in people 65 and older. And a very large majority of those have never been boosted beyond their initial vaccine. And so there is a belief, and we believe strongly, that these boosters help give additional protection to people 65 and older to keep them from suffering severe disease, and also it'll decrease symptomatic infections by about 50%.
And 20,000 people hospitalized per week from COVID. But the numbers do show, 98% of us, according to the data I've seen, have some kind of immunity, whether we got COVID, we were vaccinated, or pretty much like everyone I know, both. We were vaccinated and got COVID. So that won't protect us?
It will protect you, but this booster provides kind of an incremental benefit on top of that protection, just to give people who either have a deficient immune system or older people with waning immunity that extra boost to keep them safe, to keep them away from severe disease and hospitalization.
Yeah, something that's out of the news cycle a little bit, but it's still killing people. Let's talk marijuana for a second here. There's a new study out that says marijuana can be really bad for you.
Massachusetts General Hospital looked at 435,000 people in the mid-2000s over a 4-year period, and saw that people who smoked marijuana daily compared to those who didn't smoke marijuana at all had an increase in heart attacks by 25% and an increase in stroke incidence by 42%. Even if they only used marijuana one time per week, there was still an increase in heart attacks by 3% and an increase in strokes by 5%. The fact that there's a dose response here, the more you take, the worse outcome you could have, likely suggests that the cannabis itself is having an effect on the cardiovascular system, causing these problems.
Yeah, I thought it was interesting, too. It didn't matter how you used it, whether you smoked it or it was an edible, kind of similar results there. There is a debate raging here in Wisconsin whether to legalize, and, supporters, they often point to the medical benefits, the medical use benefits, specifically as a pain reliever. So as a doctor, with this new research, does it make you view marijuana use any differently?
Well, you wonder if this looks very similar to how things looked in the 1950s and 1960s when they were having the same discussion about cigarettes. Are cigarettes really causing cancer? Are they causing heart disease? It sort of feels like history revisited here. And so it's something that we definitely need more information on. We definitely need more science to produce more results for us to make conclusions. But it is beginning to look a lot like that same picture of the cigarette story in the 1950s and 60s.
Might change some people's minds on marijuana use as, this conversation continues at a really strong point here in Wisconsin. Dr. Bill Hartman, appreciate your time today.
Thank you.